Hi, I'm Dr. Dale Bradley, Medical Director for DNA Stat and practicing internist in Tyler, Texas. Pharmacogenomics is utilizing DNA information at the molecular level to determine if a patient will respond to a medication and which medications might place them at higher risk. And it looks at the way the liver processes medications through the cytochrome P450 system. Before the advent of pharmacogenomics, a provider would have to simply guess and make assumptions on which medications would benefit the patient the most and which ones would harm them. And really, technically speaking, that's very hard to make that decision correctly in the majority of patients. Now with this new information and new technology at the DNA level, we can make very clear directional decisions clinically to, again, reduce the risk of negative outcomes and negative effects in patients. Although we started with Plavix as the initial medication in terms of looking at how the cytochrome P450 system metabolizes and how it varies between patient populations, we now have incorporated this in terms of general medicine, and across the boards we look at it from anywhere from proton pump inhibitor use to anti-seizure medications, anti-epileptics, beta blockers, antidepressants. Are a great topic because we can fine-tune these medicines for patients instead of guessing and creating a lot of negative outcomes, untoward side effects that they really don't have to go through. We can choose the right medicines earlier on. And it doesn't just stop with depression. It certainly moves through in the category of treating hyperlipidemia with statins, and other medications for rhythm disturbances, atrial fibrillation, antiarrhythmics, and just a myriad of medications that we can look at in terms of knowing which medicine to use for which patient based upon their certain isoenzymes and if they're a poor metabolizer, an intermediate metabolizer, a normal metabolizer, or a ultra-rapid metabolizer. The good news is the test only takes 10 to 14 days to come back, and when it does, attached to the DNA Stat report is a PharmD report, which gives us very, very clear, concise interpretation summary, letting us know basically which direction to go, or at least suggestions on which clinical direction to go when it comes to changing medications. But already in 1 year, I've seen great outcomes, even in the short term. From everything from using the right beta blocker to the right antidepressant, the right blood thinner when it comes to treating a multitude of cardiac issues, and as simple as using the right proton pump inhibitor and the right amount for patients who suffer from GERD and dyspepsia. This is really neat to be on the cutting edge of technology and to share it with your patients who are really gracious and very thankful that you as a provider have gone out of your way to make another test available that could really save their lives. And it's really exciting to be on the first wave of this instead of being lost and trying to play catch up. It's really exciting to jump out there, get ahead of the game, spend a couple weeks really getting your feet wet with it, and you'll find overall it really is not a hard process to learn, and it's so valuable every day in clinical practice. To see how DNA Stat technology improved the quality of one patient's life, please watch Jerry's video next.